Employers can play a significant role in supporting people experiencing problems arising from their alcohol or other drug use. Only a small minority of people who use alcohol and drugs experience problems as a result of their use. For most people, the risk of developing problems tends to increase as the frequency of use or the amount being used increases. For some of these people, their ability to manage their use and limit its impact on other important areas of their life becomes a challenge. Some people have difficulties when they rely on alcohol and other drugs to manage other problems, such as chronic pain, difficulties with sleep, or with psychological distress. Prevention programs can help to reduce the risk of people developing problems with alcohol and drug use in the first place. Prevention often includes providing information to raise awareness about risks and harms. Prevention can be for everyone, as well as targeted at particular populations at risk of developing problems with alcohol and drug use. Once someone is experiencing some problems, supports and treatments can be offered in a way that matches the severity or duration of their difficulties. This is referred to as a stepped care approach. In stepped care, people with the least serious difficulties are offered low-intensity, short-term supports, often provided by a community health provider like a GP. These types of brief interventions may be a single session or a few sessions and include an assessment to allow people to take stock of their use and identify strategies to make changes or limit problems. Often at this level, people can engage in self-help strategies to manage their use. The next stage involves a medium intensity treatment for people who are experiencing some problems with their alcohol and drug use. These supports or treatments are often provided over a period of weeks as an outpatient service and involve seeing a health worker, like a drug and alcohol counsellor, a psychologist, or a social worker. These services can be provided in person, over the telephone, or via video conferencing in what's called telehealth. When someone's problems with alcohol and drug use become more serious, more intensive treatments are offered. An example might be where people need medical support to stop or significantly reduce their use of alcohol or other drugs. These treatments may include inpatient services, for example, residential withdrawal or residential rehabilitation. The treatment and support services at this level tend to involve a longer duration of care. Organisations have a few ways they can apply a stepped care approach. They can consider how their overarching employee health and wellbeing programs support a preventative approach, helping to ensure that people don't develop alcohol and drug problems in the first place. Employee assistance programs can certainly be thought of as an opportunity to provide a relatively low-intensity support for people with mild to moderate problems with alcohol or other drug use. It's a good idea to understand what type of support and help someone at your organisation will receive if they access your EAP. 360 Edge can support you to support your employees by ensuring that your health and wellbeing policies and procedures are informed by best practice approaches. We understand alcohol and drug use and how best to support people experiencing problems with their use. We understand the important role that employers play in recovery and supporting return to work. To discuss your organisation's alcohol and drug policies, contact 360 Edge.